Compass CP is very basically an upgrade from the eCare app that you guys are used to. It houses the assessments and basically organizes your patients, keeps track of their timeline, keeps track of their care plans, and follows the workflow that Megan laid out in the Compass study and what we've learned through the study and how to apply it. So it's embedded into Epic, so you log into Epic like you normally would. And I have my Epic set up, but I know everyone's a little bit different and customize it, but my Epic lands right on the patient list here, which is where you'll need to go as a little screaming man icon is what I've been calling it. And then it shows up not only as a button on your toolbar up top, but you can also customize any personal list to add a Compass CP call on. And so you can push patients directly from Epic, say the patient's in the room with you right there, and you want to just jump right into the assessments and jump right into workflow, you can do that straight from Epic. But the typical workflow, you would click on the Compass CP dashboard. And as you can see, as it loads, you're not leaving Epic at all. It's not popping out in another tab or anything like that. So this is the main dashboard, and I'll go ahead and have it there. This is the main dashboard where you can see all the patients that you're actively taking care of. You can see the hospitals that they're enrolled in. So hospitals like CHS that have multiple locations can have the different ones isolated here, or you can focus on just the one hospital. So if I'm the provider, I can see that I have 89 patients waiting for me, so that's quite a lot. But this is the test environment, so we're not in violation of HIPAA. You guys are all okay. It's not, you're not looking at actual Wake Forest data. And Test Amy is okay.
And so for those of you who have spent the past couple of years identifying your patients by whatever means, like, you know, printing off copies of various reports throughout the day to try to find your stroke patients, just think about the time that this would save you. You know, by the click of a button, you can see on a daily basis what stroke patients you have in-house.
Yeah, exactly. So if I'm the clinician here or practitioner or whomever you guys deem as the appropriate person to do this, I would go over to my patient management tab. This is a collection of all the patients that I've ever taken care of under my name specifically. But if I want to look at those pending patients, I'll go to pending approval. And this is where it's loading directly from Epic overnight or during the day. When a patient comes in, it's monitoring Epic and monitoring admitting ICD-10 codes. And we have a list of just over 100, I think it's 123 different ICD-10 codes, which you can add to them, you can take them down depending on what you want to make a priority. But the patients who come into the hospital will be pushed into this list here for you to assess. And so the easiest way is to grab the patient here, and you can view their card. So like some of you are familiar with qualifying patients, you can grab their MRN directly from here and keep Epic open. Find the patient. Trying to go faster than technology here. Pull them up. And you can toggle directly between their chart and Compass CP pretty easily back and forth. So you can determine whether a patient's ready to go into Compass CP, say you're waiting for where they get discharged, if you're waiting to see if they go to rehab or SNF, or you know how you guys are used to qualifying Compass CP. But again, this is a tool, so waiting to see if the patient's going to be discharged at all, anything like that, this is where they would sit and you can assess them. Just making sure we have a good zip code here. And this is where you would give them a condition. So not only do we work in stroke, we also do a little bit with heart failure and cardiology. You would want to make sure to indicate that this is a stroke patient, and then it's asking you when this patient was discharged. We can go ahead and put today, and then this is where you would approve or reject them. Okay, and so then the patient should go right into your dashboard there. Let's see, Rudy Jean right there. There's another way you can do this. If you go under patient management, say you're in a hurry, you're not moving through the whole list, and you want, and again, the patient's sitting right in front of you, You can also use Compass EP to search Epic and search your hospital's database for a specific patient. And this will look through Epic in real time and grab them right away and pull them into Compass. And that's the same process here where you would grab it. This patient's already been added. I knew that they were in the test patients, but this is where you would come and change their information and have them go into where you need them to be. And you can also search by their MRN too. I know people tend to like that a little bit better. So after that, you're ready to take care of some patients. You'd come back to your dashboard, and this is where you can see the workflow and how you manage the assessment and manage your patients. So people who are familiar with the Compass workflow, this is a little bit of overview or review for you. But folks that are new, the assessments are triggered based on the discharge date. And after the discharge date, the Compass model would like for you to do a 2-day post follow-up. So within 2 days after leaving the hospital, give the patient a call, schedule an appointment for them to come to the clinic, review some of the basic things, review their health. And then once they come back into the clinic, they will receive the functional assessment, which is typically between 7 and 14 days after they are discharged. And you can see these are color-coded. So the timing is important. So the blue icons indicate people who are ready, geared up, waiting for their assessments to take place. The green are assessments that have been completed, and then the red or pink are the icons that indicate that this is an overdue patient, and maybe try and get them on the phone or try and get them in the hospital and see what's going on. So we can go ahead and grab one of these patients. I did this patient earlier today, so this opens up their specific timeline. You can go back to the dashboard easily, clicking that same arrow in a box icon, and you can see the patient's quick information, quick calling card, if you will. And then this outlines the timeline of their assessment. It tells you when the patient was discharged. It tells you when their 2-day call was completed. It tells you who completes them, when they're completed, and it triggers the timeline of the assessment. I did this one on purpose to show you that if you don't complete an assessment, it does save your progress and lets you know how long it's been. And as you take the assessment, this bar on the top fills in with pink to let you know how much longer you have in the assessment. So this is our 2-day call. You can go over some of the things in the 2-day call. But basically, you're identifying yourself, you're asking to speak to the patient, you're going over any concerns, you're talking about have you seen anything new or noticed anything new in your care. And the goal, and yeah, it's telling me I can't move on. But the goal of the 2-day discharge follow-up call is to get the patient back in and make sure nothing extreme is going on with the patient. You can quickly go back to the timeline by clicking on the Compass icon at the top. And then from there, you can, when they come back into the hospital or to the clinic, you can start their post-functional assessment. I've already pre-populated this one for speediness. But it goes through the numbers of the patient, so different things that may be affecting the patient. It also begins assessing the patient, such as, are you able to buy medications? And we collected these assessments and the questions from a collection of clinical staff here at Wake, and we got input from other hospitals, and especially you guys on the ground working with the eCare app and providing feedback on what works, what doesn't work. And that's how we were able to compile all these different questions.
Yeah, absolutely. And so you'll notice for those of you who have used this assessment before, you can see that it has been streamlined based on your really valuable feedback. All of the assessments are more concise now than they were during the study phase.
Yeah. And it's a dynamic assessment as well. So as you're moving through the questions, if you get a patient that doesn't seem to be too complicated, it's pretty easy to move through, and you can tell you're going faster. And that's the best part about the pink line at the top filling up. You can tell if a patient indicates that they've fallen, you can see the line kind of jump back a little bit, and then if they've only fallen once, it'll jump up a little bit. and it really gives you an idea of how long the assessment's going to take based on how much care the patient needs. Then we can come back to the dashboard here, and as you can see, this patient answered all the questions correctly to trigger the caregiver assessment. So with the caregiver in the room, you would go over things to make sure the caregiver is getting everything they need, make sure the caregiver understands the quality of care that the patient needs, and making sure that the caregiver isn't overly worked or having too many things on their plate. Also, the provider report populates, and we can open that in a little bit, but this is so you can give the patient or you can send their primary care physician a quick summary of what happened that day and talk clinician to clinician and be more direct here. And so this is where you would hand the patient the care plan, which I'm sure some of you are familiar with, but those of you who are not, the assessments trigger different outcomes, and so every care plan is custom for that patient. So you go and hit build, and this is where a lot of your input is needed. So sometimes the patient has a whole lot of medical things going on, and you don't necessarily want to overwhelm them with a huge care plan. So some of the things on the care plan can be taken off. So maybe mobility and safety and physical activity, you don't need both of them encouraged, so you can pick one or the other. But there are some that you cannot unclick, and this is some that our director and again through your feedback in the clinics, we determined that these are really important steps that should not be deleted, but we wanted to let you know that the patient did trigger these areas. And then when you scroll down, the beautiful community-based resource that Megan showed you earlier connects directly to the app and links. The app is what links the local community-based resources to Epic and to the specific patient in the room. So it grabs the patient's zip code straight from Epic and gives you a list of resources around them, again, using the directory that we keep it up to date and that people can add to, and lets you know based on what is triggered, based on these items triggered in the assessment, what are some good community-based resources for the patient to take part in. You can increase the radius up to 20 miles from the patient's house and grab some resources here. So let's get in some fitness, what we can do with vocational, and let's do some aphasia things. You can have the option to email to the patient. You can preview it if you'd like, but we can just go ahead and click build here. Loads the questions. When you hit open, it's a care plan for the patient based on the assessment that it's figured out. You can, if you have the right version of PDF, you can go ahead and sign it here, put your phone number here if you'd like. But basically, all the things that the patient indicated in their care plan or in their assessment gets populated in the care plan. It goes through some red flags, things for the patient to be aware of. And again, this is clinically facing to patients, so you're talking to them. So it's all about education and letting them know the things to look out for. It reviews their numbers with them. You know, it talks about how they maybe didn't know all the risk factors and make sure to include all those risk factors. Again, she talks about how she had difficulty using her hands, and there's stiffness. She was limited in her walking. She had trouble speaking. She needed to go ahead and get a regular doctor. This person didn't have a primary care physician, and that she had trouble taking her medication. At the end, it reviews a little bit about Compass really quickly, talking about why these are the elements that we've chose to highlight. And then at the very end, reviews what to look for again, if you're the caregiver, if you're in there, if you're the patient and something's happening to you, and then it connects you to your resources and indicates what exactly was on the assessment that caused that resource to come up.